If you were looking for two experts, we would have let you down a long time ago. If this show were limited to the information that Jonathan and Brad could bring to the table, this show would have pod faded. That's a term, Brad. But fortunately, we are not. We made the decision very early on to crowdsource, to bring in best practices, best ideas, your feedback, your knowledge base, and over time, look for the patterns. I think that's one of the things that has given this show legs. And this past week with RIP Medical Debt, I think the point was proven that if we can continue to foster these types of conversations, we win, but also those around us, those in our zone of awareness, those whose lives we have some impact on, they also win. In this case, we are taking an inside look at medical debt collection and medical debt forgiveness. Very excited to go back to some of those big takeaways and bring in feedback from the community. Welcome to the Ultimate Crowdsource Personal Finance Show. This is your Friday Roundup.
You're listening to ChooseFI Radio. The blueprint for financial independence lives here. If you're looking to unlock the secrets to financial independence and early retirement, you're in the right place. Stay tuned and join a community of like-minded people who are getting off the hamster wheel and taking control of their lives in the pursuit of financial independence. ChooseFI, your home for financial independence online.
All right, Brad, this week talking with RIP Medical Debt. It's funny that 3 or 4 years ago now, I remember seeing that special with John Oliver last week tonight, that week then. What's the name of that show?
I think last week tonight.
It just rolls right off the tongue. It was funny that actually at the beginning of this year, you had seen an article that I guess re-sparked that, and you came to me beyond excited about this idea.
Yeah, I channeled my inner Jonathan there, and I was just so enthused. I read this article, I think it was in Long Island Newsday, and I'm sitting there reading about this company that is basically buying up debt for a penny on the dollar and extinguishing this debt. There's no gotcha at the end. There's no tax consequence. They're just buying this as a not-for-profit and getting rid of it. And it just really struck a chord with me. And yeah, you're right. I brought it back to you. I'm like, we have to get involved with this not-for-profit in some way, shape, or form. And so, yeah, it was kind of cool to come full circle to get Craig and Jerry actually on the podcast.
So to kind of do a little compare and contrast here, and this is not a slam, but huge thanks actually to John Oliver for highlighting the story. But at the time that I heard John Oliver do it, it didn't connect with me at like an emotional level. It was more like, wow, this is crazy. And John Oliver wants to donate more than Oprah. So he's found a way to do this at a very optimized way. But the human connection, that piece, that didn't really click with me at the time. Hearing these guys' story and how they came from the other side and how they saw the problem, and then because of where they were uniquely situated with their skill set, bringing that back and looking for a way to help people and do it at such an amazing, as you said, ratio, one penny on the dollar. In this episode, it really clicked with me that these are actual human lives that's being affected. And tied to that episode, we'll go back and pull out some of those big themes. But I actually have a personal story that is timely and is related to a lot of the big concepts that they discussed. And I thought maybe we could use this opportunity to go and hash that out. So my wife and I just welcomed a second child to the world. And this has been one of our most expensive medical years ever, partially because health insurance is now being paid for by us as opposed to an employer. Self-employment, health insurance is...
Yeah, it's funny how you realize just how expensive that health insurance is when you're covering the entirety of it.
Yeah. So, $1,000 a month in premiums. Then, oh, great. Well, now I have health insurance. Well, interesting that you might say that. Then you also have a $6,500 deductible per person. Then you have a $13,000 deductible for your whole family. It is basically like, when you add up those two together, basically you have paid $27,000 in medical bills before you get the benefits. But we have health insurance, so that's great. Anyways, I knew that going into this, eyes wide open. I knew also that we were going to have this pregnancy plan this year and that it was going to be expensive. But I also knew that I expected my wife's medical charges to exceed that $6,500. Now, part of that was with my wife's doctor. We had actually gotten on a payment plan and we had front loaded about $3,000 worth of expenses to the doctor. We go through the whole process and I'm kind of tabulating calculating in the background how much my wife's bills are costing me, because I'm expecting at some point I'm going to get a bill for $0 because the tab has been picked up. Well, when it's all said and done, to my surprise, I get a bill from the hospital charging us $4,000. So you're all post, everything's behind you, all the bills you paid for the whole year are gone. And I get a bill from the hospital, frankly, right after the episode with Jerry and Craig, which we recorded just a couple of months ago. And I get this $4,000 bill, and now I'm thinking, all right, I got to know how to itemize this. Where does this actually land? This can't possibly be true. I know I have hit this out-of-pocket deductible for my wife. How is this even possible? And I called my insurance, and they said, well, see, what happened is the hospital put you in a private room, and we only cover a cohabitated room. You've got to share the room with a second person, so we charge you more. I was like, well, wait a second. I don't think you know how your plan works. There's a max out of pocket, and we did not request a private concierge room. We just went to the hospital that was on our formulary and had the baby. They said, well, you should take that up with the hospital. I'm ready to make phone calls now. Jerry and Craig got me amped. I'm going to track this thing down. I'm going to get an itemized list. I'm going to know everything. I call the hospital, and they say, well, we just put you in the room. Your insurance just said that you hadn't met your deductible yet, and this is just what you owed. Well, wait a second. I know how the rules work. I have a $6,000, and I know this was several $1,000s past that amount. So now I'm in this investigative journalism research mode. I'm tracking every single thing out. And I actually, at this point, realized that one of the keys to me understanding how much my family has spent in medical bills is actually logging on to my insurance website and seeing the paid claims that have actually come through the insurance, right? And this is actually a tip that I want people to lock down, is that when you have this information, it's less easy for you to be taken advantage of. Knowing what your plan is, albeit no matter how bad it is, knowing what your plan is, what the rules are, and then making sure that all the players, and there are many players, doctors and hospitals and everything else, are abiding by this. I get on my insurance formulary plan and I see that this $3,000 that I front loaded to my physician for, the OBGYN for these regular visits, they've never billed the insurance for any of that. So basically they're sitting on $3,000 worth of cash. And then on top of that, they actually billed the insurance. The insurance paid them in full. So it's like a timing issue. My OBGYN has been paid twice, once by the insurance and once on this payment plan that we had set up. And so suddenly, and this is 2 months after the pregnancy, I haven't heard hide or hair of it. And I was like, wait a second. I am past the deductible. That nearly $3,000 in payment plan that we paid up front is just sitting somewhere at my doctor's account. Suddenly now, I have the information. I call my wife's OBGYN. I said, the payment office, obviously, not the actual OBGYN billing. And I say, I think you owe me some money. And they take like 3 or 4 seconds. I hear a big gulp. Let me put you on a short pause. They come back and say, oh, yes, you're absolutely right. We owe you $2,700. We are going to go ahead and get that. And I was like, so will that be in my mailbox tomorrow? They said, we'll get it out to you this week. So, right? There's a payoff there.
That's incredible. So yeah, you threw a lot at us there. First, you said something to the effect of, I was waiting for that $0 bill, right? I think a lot of people don't even know how their medical insurance works. Your deductible in that case was somewhere around $6,600 per person. Because your wife, Danny, had reached that full amount, you anticipated you're at your deductible. Every dollar thereafter is picked up by the insurance, because actually your plan has 0% coinsurance, as it's called. And it's funny, it's just like anything, it's like learning a new language. That's what a lot of this stuff seems like. With this coinsurance, people look at that and say, what on earth is that? But it's just after you reach your deductible, it's the percentage picked up by you, and it's the percentage picked up by the insurance company. In your plan's case, you have a 0% coinsurance, which means, sure, you're paying $1,000 a month in premiums, so you're at $12,000, and then you're somewhere near this $6,600 deductible, whatever it may be, $6,650, I think it is. And once you get to that point, then finally, you get your first dollar of benefit from the insurance company. And in your case, because you have 0% coinsurance, you would pay 0% of every subsequent dollar of health insurance bills. A lot of people have, I've seen 10, 20, 30% coinsurance. I'm sure it goes up higher than that, but those are plans that I've investigated. So it's important, just like anything, to know the rules of how this works. You went in with eyes wide open, and I'm talking conceptually here. We can dive into the actual nuts and bolts of your situation, but you went in with eyes wide open and said, all right, I'm spending $1,000 per month out of pocket for these premiums. But really, what was left unsaid is that is a value proposition that I've made, that I basically can't be ruined financially because I have this insurance. Sure, it is not ideal, right, to spend $25,000 out of pocket in a calendar year. Right? But I mean, that's the worst case scenario in your situation, right? It's the worst case scenario is $25,000 out of pocket in a calendar year. That is horrible and clearly would ruin most people. But for you, because you're along this path to financial independence, you have options, right? And you have that little bit of leeway. And you can say, all right, this is the decision that I've made for my family that, sure, we could go on Liberty Health Share. Like I personally have talked about for years here on the podcast. My family used to be on Liberty. Liberty Health Share does a wonderful, marvelous job for what they are, but they are not responsible for how the doctors and hospitals interact with them. And that's actually part of where I ran into an issue personally with what's known as balance billing issue, where the hospital came after me for about $6,000 because I thought I had an agreement basically between the hospital and Liberty Health Share. And the hospital said, as Jonathan would say, no, my friend, that's not how it works. You owe us another six grand. So it was a bridge too far for me, honestly, Jonathan. And that's why. Can
I pause you on that?
Yeah.
Just I understand. I remember what happened, and I'm glad you highlighted that. But I do want to just point out for completion that although that was incredibly obnoxious and stressful for you and your family, like there was resolution there, right? And I believe Liberty did play an active role in that resolution.
Yeah, they did. I'm probably actually conflating a couple of situations because we actually had 2 or 3 different scenarios with balance billing. And one of them we wound up paying out of pocket for. I think I got a 10% discount, which is a far cry when Craig was talking about, oh, you should be able to easily get a 50% discount. And of course, there are caveats to that. But this one, in this particular case, yes, you're absolutely right. Liberty, they hired lawyers, they negotiated with the hospital, and they did wind up not only negotiating and getting to a resolution, but they wound up paying for that amount. I actually thought I would have to pay for it out of pocket personally. So when all was said and done, those situations worked out well. But again, it's risk tolerance. And I think this is what everyone's decision point. If you're listening to this, the takeaway for me would be find out what your risk tolerance is. Because for me, okay, this is fine when it's a $6,000 bill, right? I can pay that. That's no big deal. But what if it's a heart attack? What if it's a $200,000 bill? Do I trust at that point Liberty, who has no contractual obligation to pay that amount? Do I trust them to negotiate and pay it? No, I really don't. And again, I have no qualms with Liberty. They were wonderful to me, but it's not written in stone. So that is just not something I wasn't willing to risk a $200,000 medical bill. I just simply wasn't.
Yeah, and that's actually a fascinating point. I want to come back to the discount in just a second here because there was something else tied to Craig and Jerry. But I think people ask, why don't you do more health insurance episodes? Well, it's because here in the United States, there are no great answers. There are options, and you need to kind of know what they are, and they can be fluid. You know, one stage of life may be different than a different stage of life. But to your point, in the context of picking between health insurance and paying market rate versus a health share, really it comes down to risk tolerance. I mean, that's one of the biggest things that you need to be aware of. And so I think when you're talking, like, if you're saying that there's an 80% chance over the next, 10 years of you having a $10, $15, $20, $30,000 medical bill, to me, if that's the worst case scenario, like probably it's going to favor the health shares. You're going to do so much better with the health shares. but on the flip side of that, and to your point, if you're starting to talk about 6-figure medical bills, 7-figure medical bills, I mean, if you're talking about $800,000 medical bill for a transplant or something like that, or pancreatic cancer, or any sorts of these upper echelon type conditions that would, like, at that point, that's when you're suddenly not so worried about your health insurance deductible. That's when your health insurance premium, your health insurance deductible. While I'm here with maybe occasionally having, because of a family, having a $10,000 medical bill, I get irritated because, let's be frank here, with the health share, what did it cost? Let's put a little compare and contrast here. When we were on that, it was $450 a month with a max out of pocket. I'm talking about Liberty specifically here, with it for my family of like $1,500. And then I think, Brad, wasn't it like $1 million of coverage? Like, yeah, okay, so there was a cap on it, $1 million of coverage. But in a perfect world where everybody just says, okay, great, you have this, or they say, Like basically, here's how it would work with Liberty. You never tell anybody that you have insurance. You never tell anybody that you even have a health share. You basically go and you pay cash for all of these procedures that you need. You take these receipts back. You ask for cash discounts. We'll come back to that in a second, right? You take these receipts and you just send them off to Liberty and they reimburse you everything over $1,500. I mean, that is super cut and dry. And if you try it and it just works with some of these smaller dollar amounts, you start having more faith in the system and your risk tolerance, you're like, oh, wow, this is great. But then suddenly you get struck down by this 6 or 7-figure health condition that you've suddenly developed that came out of nowhere. Like now you're like, oh, will they still come through? And they might. The answer is not that they won't, right?
They absolutely might. And yeah, that's a crucial part. We're not disparaging Liberty here in any way, shape, or form. Again, they were wonderful to me for years. But like you said, it is all about risk tolerance. I could not risk ruining my entire family's financial future over a decision like that. That is the entire point of insurance, in my estimation, is looking out for these black swan events that you cannot foresee. You can't foresee the car accident that could happen to you and you need to be in the hospital for months undergoing surgeries. Like you just can't foresee that. So if you look at the dollars and cents here, it's a little under $7,000 per year, max out of pocket, including premiums for Liberty. $7,000 as opposed to, like we said, for our insurance, it's about $25,000 max total premiums and deductible out of pocket each year. That's a huge $18,000 spread that you're potentially locking in for all intents and purposes. So if we were just talking about a $10,000, $15,000, even $20,000 decision, it's a no-brainer to go with Liberty. But that's not what we're insuring against, in my opinion. But again, this is my personal decision. This is not your decision as Jonathan or the listener even. It's what do you have the risk tolerance for? So for me, I'm in a financial place where it makes more sense to cap that massive, massive downside and pay a little bit more to the tune of maybe $5,000 to $10,000 per year out of pocket and just sleep well at night. So I think that's kind of my final word on this as far as my decision making.
Oh, I don't do final words.
No.
Let's just keep going just a little longer.
Hence I said my final word.
All right. For thoroughness, there are people that have additional thoughts that they're raising, things that they're considering, reasons that because we have people in our audience that are doing health shares. And I don't think either of us started this conversation to try and talk you out of doing a health share. More just explain why, Brad, you were on one and you moved over. I think there's a couple other things to keep in mind here. One is you're not just responsible for yourself. You're also making a decision for your entire family. I noticed that for myself, my medical bill, I never went to the doctor. I did my physical and that's it. I seem to go to the doctor every other week for my son for earaches and for my wife for her regular visits. My family visits the doctor multiple times a month these days, it seems like. And the other thing here that I wanted to mention is that while we are talking about full freight insurance, the ACA is still intact. The ACA does still have subsidies and your situation may vary. So there's a couple other things just to keep in mind. We're self-employed. We're paying both sides of that health insurance equation. But let's talk about upshot here. Because the business is in a marginal tax bracket, paying health insurance through the business does provide, it's a tax write-off. So although we are paying that amount, like if you're a business owner thinking about this, that's just one thing to keep in mind, that this could be a deduction for your business. That's one point I wanted to make. So there's a slight, yes, it's apples to apples, one cost versus the other, but the tax code has nothing to offer for health shares. You're not getting any tax write-off for health shares. But as a business owner, you might be able to run through this business and get a deduction. Point 2, ACA subsidies. Come back to that. So I'm just thinking about individuals that are truly thinking about this in the context, well, when I retire, do I need to account for $25,000 a year in premiums? Well, maybe, but it kind of depends on what income level you choose to live off of. So one of the great things about being in this community and being on this path is that you kind of decide how much you make. And you can decide to bring home $50,000 a year, maybe from capital gains. You can decide to bring home $120,000 a year, maybe from that same vehicle. Depending on how much your life is going to cost in your post-retirement, and I mean this retirement more in the sense of I'm leaving the job that provided me employer, health insurance, health insurance that was subsidized by my employer. And now I'm responsible for it. The amount of your life, and forget health shares. Let's just put health shares to the side. Health shares are just health shares. It's probably gonna be about $6,000 a year. But now if you're talking about insurance, now you're looking at ACA subsidies potentially if you're in certain income brackets and thresholds. For example, we know an individual lives in North Carolina with him and his spouse and their 3 kids. They have an income of roughly $50,000 a year that they draw down and a net worth well past $1 million. So well past $1 million. But because that's in their investments, it's not income that's being generated by the business. They pick how much they want their life to cost. Their house is paid off. So if they draw out $50,000 a year, that's what their income looks like for taxable purposes. But based on the way the ACA is structured, their actual ACA cost is maybe a couple $100 a month, maybe. So you just need to be aware, like, depending on where you're going to fall, how much income you're going to draw, whether or not you're going to be picking up. Some people use part-time jobs. You're going to retire from this. You're going to work part-time. We hear it commonly coined as the Starbucks plan. Starbucks offers benefits for part-time workers on day one. I'm not saying to do that. I'm not saying that's ever been on my plan, but I've heard people talk about it. So there's no one way of tackling this, but you should be aware as you start to cultivate these plans that involve maybe you not working for the employer that you're working for now, what paying for healthcare or not paying for healthcare are going to look like. I think it's a valuable strategy.
Yeah. And Jonathan, I just wanted to interject as the resident accountant here. Great point, certainly, about the deductibility of health insurance if you have this through a business. It's funny. That's something I did not even think about when we're setting up this apples to apples, but that's really important to factor in. And, it's funny. One of my pet peeves is the phrase write off. I feel like it has such negative connotations, like, oh, they're just writing it off. They're getting it for free. It's basically, in actual parlance, it's a deduction. So this is a tax deduction. It's so funny how common, I swear, Jonathan, that has been a pet peeve of mine.
I will do better, Brad.
No, it's not with you. It's been a pet peeve of mine for like 20 years now. It's because, they're just writing it off. It doesn't exist. It's free. In this case, it is a business deduction. So basically, it just gets added to all of your other deductions. You take your gross income, you subtract out all your deductions, and you get your net taxable income in essence.
Well, I'm relatively pleased that with all the words that I used, Brad, that was the only thing that I got that I needed to be corrected on. So that's not bad. Hey, let's talk about discounts for a second. It says you said you negotiated a discount, and I think there's actually something here. So you know how when you haven't passed your deductible yet, and your insurance comes back to you and they say that, hey, take a look at this. I know you paid this, and I know you haven't passed your deductible, but the bill was going to be $800, but your costs are just $400. That's because you're getting this discount. Look how we got your back. And that is largely because the market rate isn't the market rate. Over time, I don't want to use the word conspiracy here, but it's just a little ridiculous that basically what's happening is insurers, to give the illusion of benefits to the people that are using their services, have negotiated better rates en masse. And health systems, realizing this, the game, have inflated their rates so they can give the insurers the appearance of discounts, so they can give the customer, you and I, this feeling that we're winning, even though we're just paying the market rate. But now it has this discount. Hey, I'm only paying $400. No, the market rate's $400. This is what everybody's paying across the board. You know that. Intellectually, you know it. We still feel good about the discount. The little thing to pull away from that there is kind of twofold. One, you have the ability to negotiate discounts on your own. When you say, I'm a self-payer, do you offer a discount for self-pay? If you can be proactively doing this, if you can be shopping for this ahead of time, if you can be in charge of your own healthcare, you can negotiate some of these rates. It's crazy. It doesn't work as well for acute when there's a lot of emotion ranging on. Well, it does. You just may not have quite as much control. You're working in the confines here. So, perfect example. I have now established that I have this check coming back to me for $2,700, but I still owe this $4,000 check to this hospital. So now I realize, all right, I'm stuck paying it. This is not something I'm getting out of, and although the insurer and the hospital are providing me these reasons for it, I realize that none of that, they don't really know. They're just trying to interpret data, but I now know the data and I know I'm going to have to pay this bill. So I call them to say, all right, I'm calling to pay this bill. Like, oh, were you aware of the cost? Yeah. Can you go ahead and pay this all at once? I don't know. It's a lot of money. I mean, can you offer me a discount if I can do this all at once? I can try. And they're like, let me go check and see. They came back and they said, yeah, we can give you a 10% discount. It was like $600 in this case on this bill. They saved me $600 by asking for a discount. Now, one, everybody needs to ask for a discount, right? Just ask for a discount. But then two, what's the incentive generally for them to have these discounts baked in? And if you think about what Craig and Jerry were basically saying, it's because one, these numbers are all over the place. There's market. I bet I paid more than the actual market rate, even with that 10% discount. But then two, because I was going through the process of trying to figure out where this money was, the debt had kind of aged in. It started to approach that 30-day plus window. And at some point, this hospital is going to ship off this debt to a collection agency for a fraction of the price. The collection agency, if they can collect the full amount, will get the whole amount. So the hospital is already on the verge of writing off maybe 10, 20, 30% of this. If the collection agency can't collect it, they're going to sell that to another tier agency. And then that agency may pay 50% or 30% of the actual market value. And it keeps going down and down the line. That's why when Craig and Jerry are swooping in, they are finding the uncollectible of the uncollectible, right? I mean, this debt has like disappeared off the face of the moon. It's still hanging out there. It's still plaguing the people, but the hospital gave up on collecting it a long, long time ago. And so this is to Craig and Jerry's point. If you're, to your point, Brad, you're like, well, I felt bad that I couldn't get to 50%. That's because you were too early in the chain. You are still right there at the door of the hospital and you're going to be able to negotiate something. So everybody hear this. You will be able to negotiate something. But if you're cleaning up serious debt baggage from years and years down the road and you get this order, you should be able to, on your own, this is Craig and Jerry's point, you should be able to negotiate at minimum a 50% discount. Keep that in mind. If you listen to that episode or you're sharing this episode with a friend or family member, make sure they hear the verbiage. Craig and Jerry were very subtly telling, not so subtly really, they were telling us, you need to be using words like, I can try to come up with a GoFundMe. I can try to come up with a kick. You need to let them know there's no way you can do this on your own, but you'll be willing to move heaven to earth and bring your family in and pull in all your favors if you can come to some sort of agreement. If you can get that person working with you, you're going to be able to get 50% off that debt.
Yeah, and it's knowing the language again. Craig said the phrase is material hardship. Now, obviously, you have to be completely truthful, right? Like I could not have gotten that 50% discount in my case because there was no material hardship, right? I was nowhere near the poverty level or 2.5 times. But again, it's knowing the rules. And this might not even be applicable to you, the listener, in your particular case, but you might know someone who is being plagued by this medical collections. And maybe they are potentially able to get these discounts or even most of this thing written off because they are at under 2.5 times the poverty level. It would cause this material hardship, which I think they described as not being able to pay significant bills or things like that. And also, as Craig and Jerry said, you establish a relationship with the person you're speaking with. You let them know that you are being honest. I couldn't and I wouldn't, with a straight face, say that this would cause me material hardship. It just simply wouldn't. And that's why, Jonathan, I was also able to get a 10% discount. And that was the discount. I think really the actionable takeaway for most of us here is if you pay in full, in all likelihood, you can get at minimum a 10% discount. I think just by asking the question. I've had that personally in 2 different cases. Jonathan has a third. Now, albeit this is a tiny, small sample size, it's probably similar hospitals, et cetera. So your mileage may vary. But I think it's just simply worth asking the question because so many people cannot pay these medical bills. And because we are on the path to FI, we in all likelihood are in a much stronger financial position than most people that are calling up. And they are just happy to get this thing paid. Just simply ask the question, can I get a discount if I pay this in full? You might be surprised by 5, 10, 20% off. So it's always worth asking the question.
And there's one other piece here. I was actually going to try and get something written around this, and we weren't able to pull it off in time, but we will try to get this article written for our community down the road, and we'll announce it when it goes live. But I believe that if you were to then be negotiating down the line, you're negotiating on your own behalf this discount when it's in collections. So maybe you have a family member or a friend that you shared this episode with, they have some serious medical debt hanging over their head. It's been hanging over their head for a long period of time. And now you're just now in a place where you're coming up with a plan. You're handling judgments, you're handling collections, you're trying to help them simplify their life, and you're helping them negotiate this bill. And they do it. You have this $30,000 bill that's negotiated down to $10,000, something amazing. The collection agency agrees to settle this debt. How do you know then that you're not going to get a call down the road from another collection agency, right? You've made this payment, you made this arrangement. What would you want? And what I would want, and I'm sure we have a debt collection agent in our audience that can maybe help in and fill this in. We'll bring it back into our show. What I would want is something in writing saying this debt is paid in full. I would, if I'm going to do that, I would want not only the negotiated rate, but I want the collection agency to then provide to me something in writing that I could have next to this that I would never have to think about this again. It's something that you can go to court with if you needed to say this debt is resolved. And I'm sure there's some specific language there around what that should actually be. But if you're solving, pretty significant amounts of debt, even if it's for fractions of a dollar, make sure that this isn't one of those things where poor communication means that you have someone else down the road. And to your point about establishing a relationship with a person, the first step to establishing a relationship with a person that you're working with to come to a resolution, you need to know their name. You have your notebook out each time you're taking these conversations. What is the name of the person you're talking to? Every single time you end up talking to someone else, can I talk to this individual? Because this is who I was working with before. Or even if you can't, let me know. Let me tell you what happened. I was talking with Tim. It doesn't matter if they don't know Tim. They could be in a different country, but just letting them know that you keep track of who you're talking to, and this conversation is building on one that you've had before, and you have notes, they're going to be more locked in. It's going to be a better use of your time. So MK, I know we got some significant feedback from the community on this episode.
We did. So we actually had a listener write in with their medical debt story, and it was specifically dealing with a health share. So I'll go ahead and read what Clayton wrote in and sent to us. Clayton says that we are everyday people and we experience significant hardship related to medical issues and ensuing debt from December 2016 to summer 2018. We went from being a 2-income household to a single income household unplanned, plus massive influx of medical bills related to an autoimmune disease. So in 2016, in the summer, they had just graduated from Dave Ramsey's Debt Snowball, were working towards increasing their savings. They had never heard of FI or FIRE. And when their symptoms literally took them out in December, they had a mortgage, $5,000 in savings, but they had just paid off close to $100,000 in student loan debts. So Clayton writes, between spring 2017 and spring 2018, I was billed over $150,000 in medical bills. Did I mention we transitioned to a health share for medical coverage for the first time in June 2016? So it seems like right when they made this change, things started to take a turn. So Clayton writes, prior to this, I always carried traditional healthcare coverage and had never negotiated a medical bill in my life. We traveled out of state for 2 major surgeries 9 months apart. First surgery was 7 hours long in North Carolina, and second surgery was 3 hours long in Atlanta with a world-renowned surgeon. My goal is that this offers extreme hope to others that I have personally negotiated my medical bills down 75% to approximately $50,000 without any collections agency interactions. We learned to use multiple strategies to prevent paying 1 penny in finance charges, and we learned how to create space, pauses on the bills, debt while we awaited reimbursement with HealthShare Ministry. We are so fortunate to have the HealthShare reimbursement, but I learned how to negotiate every single medical bill myself. And every office system I worked with was different. So going to the point that you just said, you have to work with the people on the other end of the phone, pack your patients, they're just doing their job. So Clayton writes, I have a master's degree and work in healthcare, and I was still super nervous. I feel like I earned another degree in learning about my rights and rules and learning about different strategies. I had a lot of limiting beliefs about money and medical bills related to my condition that I worked through during this process. My husband just had an outpatient surgery, and I confidently navigated this medical billing process as a result of this hard-earned training. I share this as I wish I would have had a place to turn for actionable tips, guidance, hear a story of perseverance or possibility when I was first entering such a difficult season of our lives. I hope this email finds you all well, and I would love to share further with you. So Clayton definitely is giving us a lot of great information about their journey. And for anybody listening who is sitting with 6 figures of medical debt, Clayton was able to work through this themselves. It's hard. It's difficult. It's one of those things that just weighs on you because you're not going to take care of yourself? Of course you are. So for anybody listening, Clayton is sending you all of their best wishes and best luck and some inspiration for you all.
Well, and it sounds like, Brad, we would be able to get her on the show as well. So maybe MK also, we'll reach out to her, see about her coming on the show, but then also maybe we could get her to do like a guest post as well and kind of put together some of these big strategies, some of the scripts that she used as she was interacting with the different providers. I think that's the heart of this. I mean, because if you heard what she was saying she did, and this is very important, she didn't just rely on Liberty to do this for her, or I don't know if it was Liberty, a health share. She didn't just take the health share and say, hey, surgeon, don't you realize I have this awesome health share? Maybe that's what happened. But in the reality, at this level, with the dollar amounts that you are talking about, your best case scenario is negotiating on your behalf, interacting with them on a cash basis, and then giving Liberty the bills. Because to Brad's point, you don't get balance billed when you're interacting with the provider on a cash basis. The balance bill that is very frustrating for Brad is happening when you go into the surgeon and you say, hi, I don't have health insurance, but I do have a health share. And they share everything past a certain dollar amount. The surgeon or the system says, sure, sounds good, let's do it. So then the surgeon bills the health share for the cost. Let's say in this case, it's $50,000. And the health share comes back and says, we'll pay 30 for this. Will you accept that? And then the surgeon or health, I don't know why I keep saying surgeon. This isn't the surgeon. Health systems, the health system says, yeah, no problem. We'll take that. But then the health system looks at that $20,000 balance that wasn't covered by the health share and says, oh, well, we'll just send that to the patient. Now, that's not the intent. The intent was they just take the 30K, but the health systems tend to do this a lot. It's called balanced billing, and it's pretty scary. So if you're dealing with these large amounts, you do not have health insurance. They'll ask you, do you have any type of health? No, you don't have health insurance. You don't. You really don't. That's a true statement. You're negotiating a price and you will not experience balance. And then what you do once you get that receipt is you send it off to your health share and your health share reimburses you. So that's why I'm not surprised to hear Clayton saying she was negotiating all of these. And while she was waiting for reimbursement, that is a strategic way of doing this that prevents all the chaos of back because you just don't know what that health system is going to do. All right, let's go ahead and switch gears here and bring in some mailbag questions.
Hey guys. So as you know, Monday this week was Veterans Day. So thank you to all the veterans listening. And today we have a question from Nadine, who's in the military. So Nadine says, I just read another post that Amex Platinum waives the annual fee. Mind blown. I've been a Platinum member for years and didn't know this. Now I'm wondering what else I'm missing out on. I have the Southwest card and Citi double cash back. Do you know of any other military perks as it relates to FI? Thanks in advance.
Now, Brad, I'll give this one to you because this is obviously your territory here, but I believe Amex does this and also Chase as well, right?
Yeah. For years, I knew about Amex waiving the annual fees for all active duty military members. So yeah, it's the Amex Platinum, as Nadine mentioned, that is a huge one. So if you're a member of the military and you're looking to get those ongoing benefits, but don't want to pay many, many hundreds of dollars in annual fee, you can absolutely get the Amex Platinum. So that to me is a wonderful, wonderful card. The Chase Sapphire Reserve is another one that jumps out to me, Jonathan. I think we absolutely love the Chase Ultimate Rewards points. The Ultimate Rewards points, in my estimation, are the most valuable of all of the transferable points because you can take these Chase points and transfer them to, I think it's over a dozen different transfer partners. So I love Southwest, United, Hyatt Hotels, British Airways actually to use on American Airlines here in the US. So the ability to get this Sapphire Reserve card, which there's a distinction between the Sapphire Reserve and the Sapphire Preferred. Those are two personal credit cards. For me, I know, honestly, Jonathan, I've always had the Preferred, which I know you actually have the Reserve. I never wanted to pay that annual fee out of pocket. I've been satisfied storing all of my Ultimate Rewards points in the Preferred, where it's only a $95 annual fee. But with the Reserve, it's actually a $450 annual fee. You do get significant benefits from this, but it was just, and maybe this was me being stupid or cheap or whatever, but I never wanted to lay out that money. So you get a $300 annual travel credit. That is basically free of charge, where you pay this annual fee, obviously, but the first $300 in travel expenses that you pay for with that credit card are essentially wiped out. It's a free travel credit. There are other significant benefits that we'll talk about, but another huge one, Jonathan, is that when you use the Chase Travel Portal to book travel with your Ultimate Rewards points. Now, this is distinct from transferring those points out to the travel partners, as I mentioned, but you can actually book travel through Chase's search engine. And you get, instead of getting 1.25 cents per point, like you'd get with the Sapphire Preferred or the Inc. Business Preferred, you actually get 1.5 cents per point. So it makes all of your Ultimate Rewards points more valuable, actually, when you have that Sapphire Reserve. So yeah, I mean, the long and short of it here is that Chase does waive the annual fees for active duty military members. Not only can you get the Amex Platinum, but you can get this Chase Sapphire Reserve and get all of these benefits and not have to pay an annual fee.
A couple things to add on to that. So the Chase Sapphire Reserve is the one that I've had for several years. I just keep holding on to that one. The fee I find more than worth it because you can use it. Just to give the audience some context here, $300 of that is reimbursed towards travel-related expenses. The no-brainer for me, the one that I seem to always works for, is the Easy Pass tolls. So if you have tolls every day, you can just stock that thing up, and that's $300 towards that. The priority pass that you get along with the Chase Sapphire Reserve allows me to look like a superhero with my wife when we go on international flights, or frankly, even some domestics. When you're going to an airport ahead of time, just find out whether or not the priority pass has a lounge that you can get access to. And you got toddlers and kids getting access to a bar, a restroom, Wi-Fi, a nice chair. I look like a superhero, and it's worked almost every time that we've gone international. If you got to do a little planning ahead of time and say, all right, we're going to be at this airport, where is the lounge going to be? And then the third thing I want to mention, rental cars. Rental cars, there's not like a great way to game the rental cars out. Maybe you have a few strategies and tactics, but when you get access to the portal, so that's the same as like booking at Hertz or Avis. You can just go to the Chase Ultimate Rewards portal and you can book your rental car from there. So it's right there. That's the point at which now when your dollars are going farther, 1.5 cents per point, you're able to get that rental car effectively for 25, 30% less than it would be if you were just interacting directly. So those three things I have used significantly. And when you tie that to all the other benefits, like the ability to transfer to your travel partner. So I had the Southwest Companion Pass, had it for the past 2 years. It's going to be coming to an end this December for me, and then we'll start figuring out what to do with my wife. But I still had about 27,000 points on my Southwest. I was just booking for this Thanksgiving for myself, my wife, my son, and then our infant child. The infant will go for free, and then we have the Companion Pass. So I have to buy 2 tickets, but then we all go for the price of 2 tickets. It was like 1,000 or 2,000 points past what I had in my Southwest allotment. So I was able to take from my reserve pile like 1,000 or 2,000 points and transfer it over and just get every little penny of value from that. So much flexibility there. And I was actually reading a little bit of feedback here. For those members, specifically today, we're talking about the Amex Platinum and the Chase Sapphire Reserve, and in particular in the context of military members, because these are cards that traditionally have fees. You can get that waived. Some people may have not known that and had these cards the entire time. There's some evidence to support, if you've been paying these fees for years, not realizing it, that you may, not guaranteed, but you may be able to get that waived. If you follow up, you hop on the call. There's individuals that have said, we've been able to get that money returned to us. So, multiple ways, but here's just why these cards are pretty cool and reasons to get excited about it as you plan out your travel journey. So Brad, if someone's interested specifically in, I guess, the Amex or this military Chase Sapphire Reserve, what should they do?
Yeah, we've partnered with Card Ratings for our coverage of credit cards, and they are an affiliate of this program. So if you did want to get started with your travel rewards journey and simultaneously support the show, go to ChooseFI.com/militarycsr, and we'll actually have an entire list of the cards that we recommend for military members. And of course, you can always find our main credit card rewards page at ChooseFI.com.
Again, that's ChooseFI.com/militarycsr. That's CSR, Charlie, Sierra, Romeo.
Well done with the official military alphabet there, Jonathan. I'm sure Google is very happy to have provided.
I did. I had to look it up first. Foxtrot, anybody? All right.
Perfect. All right. Well, next we have feedback from Emily. She says that she is taking action. I'm reading your book and thought I'd share a story. I'm not even at the invest better part yet, but was reading and groaned, earmarked the page and said, fine, geez, aloud, and got off the couch and opened a Vanguard account for a Roth IRA and another for my husband. We are already maxing my simple IRA and a family HSA, and I've been meaning to get a Roth set up too. Your book and its positive energy makes FI seem reasonable and certain if we just take action. Thank you. Thank you, Emily.
You can't just read the book without taking action. The book forces action. It's what it does.
And I think it's great to show she was already doing a lot of great things, right? She was already maxing out accounts, doing all those things. And there was still more that she could do that she was able to find value. So that's a really awesome feedback. We wrote the book to be able to help people. So it's great to see that it is helping people. And you can now get it in all formats everywhere.
Wait,
That's
tell
right.
us more. What does that mean?
The audiobook is out. Everybody who's been asking for the audiobook, it's now available on Audible, Amazon, Google Play, iTunes, your library. Obviously, we know you're listening to the podcast. You enjoy to listen to things and get information that way. Well, we are now able to give you our audiobook for ChooseFI, your blueprint to financial independence. So you can hear Chris, Brad, and Jonathan even more on your Tuesday through Wednesdays.
Well, I was actually going to say that. Spoiler alert. Thanks for MK. So Brad and I got the opportunity to record our soapboxes for that book. So Brad, you recorded your first audiobook.
Yeah. It was actually more fun than I would have guessed. It really was cool. It's a very exacting process, as you can imagine. You don't want to stumble over words or screw anything up on something that's going to be there for posterity. But yeah, I mean, it really was an enjoyable experience. Now, I'm sure Chris maybe, recording an entire 200 plus page book, different story entirely. But yeah, our little 15 or 20 soapboxes, I actually had fun with it.
It was a lot of fun putting that together. So I'm very excited with how it came out. And I hope our audience will check it out, give it a listen, leave an honest review on Amazon. And thank you so much for being a part of this with us and sharing it with friends and family. I think the book in our mind is one that kind of grows with the show. It's one that the core of the principles that we're trying to communicate are encapsulated in those 270 odd pages. And while we're adding new information all the time, talking today about medical debt collection and the more nuanced stuff, and then capturing people's journeys and the obstacles that they've worked through, at its essence, there are these principles that you need to lock down, right? You have to lock them down. And this book will give you that. And it will give it to you in a linear, non-intimidating fashion. And it treats it like a choose your own adventure. You don't have to do everything, but if you're paycheck to paycheck right now, you're going to have to do something differently if you want to get a different result. I think this book gives you the 80-20 of what those options are.
All right, MK, I think we have a frugal win tip from Jim.
We do. So Jim is looking out for everybody this holiday season. So he says, I know you guys have mentioned services for online grocery ordering in the last episodes. For November and December, Kroger is waiving the $4.95 pickup fee, making it a great opportunity to save some time and money this upcoming holiday season. So if you have a Kroger chain near you and you would like to try out their pickup service, they're going to waive the fee. And I wouldn't be surprised if other grocery chains were going to do the same thing to try to get people interested in this service. So give it a look.
Online grocery shopping is changing my life.
Yeah.
I mean, not only obviously the convenience of time and being able to go there and just get it and it be done, but I think that many of us take for granted how much inefficiency is baked into our shopping process from a cost basis when we just go in there and we just see what's on the shelf. Going up and down the aisles, trying to find that one item can be very, very expensive. And ever since really committing to this online grocery purchasing idea and building our system around that, we go to the grocery store right now it's less than once a week. And our average cost, and there's some Costco runs in here underlying some of this, so it's not 100% on, but our average cost has been right around $100 a week. It's been unreal for my family of four, three of us that are eating substantial amounts of food. It's been unreal. I didn't realize how much inefficiency was baked into us as, let me just go buy this and I'll make what we normally make, that sort of, without having a plan. My lack of a plan was getting to me, but now having this plan, buying the exact ingredients to meet that plan, I mean, we are saving hundreds of dollars and we're creating these guardrails for what we actually want to be, what fuel we want to be putting into our body. It's a win. Check it out, build a system around it. This is not an advertisement. It kind of is an endorsement just because it's so freaking awesome, but it's just if you're not doing this and simultaneously you're not happy with the health choices you're making and you're not happy with the size of your grocery budget, start with a plan, a meal planning app, then go get that grocery list, throw that on your online grocery store of choice. And Kroger, we happen to have, but there's others that offer it shipped and Instacart via Wegmans and a bunch of others, but try it. I would be shocked if you don't find yourself saving serious dollars just by actually purchasing the foods that you plan to eat. So Brad, as we kind of bring this episode to a close, I actually wanted to circle back to this excited Brad that heard about this incredible ROI on being able to resolve $100 of medical debt for $1, right? $1 resolves $100 of medical debt. When you brought that to us, you said FI is about efficiency and it's looking for these outliers. This is an outlier and this is something that I could get excited about. And, that passion came through. And I think it's one of the reasons we decided to have a show about it. And based on the feedback we're seeing from our community, I think our community is excited about it. And so we decided at the end of that episode to partner with RIP and do a campaign to help them raise some money to forgive some medical debt. So I think to do that, why don't we start with you, man? Can I hold you? Sorry, I apologize, Laura, ahead of time. Brad, I think I want to hold you. Would you donate $1,000 on this Friday? We're at $1,000 to resolve $100,000 of medical debt.
Yeah, I will do that. I will personally donate $1,000 to this campaign. Jonathan, what about you, man?
Well, I'm not as far on the path to FI as you are. So I will donate half. I will do $500. I will commit $500 to resolve $50,000 of medical debt. Right.
Yeah, that's super cool. And yeah, we set up a page, short link. It's ChooseFI.com/RIP. And it'll send you over to their site where if you're looking to join us, looking to donate, looking to make your charitable money go further, donate any amount, $10. I mean, that pays off a significant amount of someone's medical debt out there. It's really a remarkable chance. So as Craig and Jerry said, in their case, we couldn't do this by ourselves. I couldn't go to my local hospital with $1,000 and say, let's make it rain, pay off $100K in debt. It doesn't work that way. It's because they have these relationships. It's because they're a not-for-profit. It's because they have this scale that they're able to do this. And then we're able to make a difference in an outsized manner that we otherwise would not be able to. So yeah, I hope you'll join Jonathan and myself at ChooseFI.com/RIP. Let's see what the ChooseFI community can do to make a difference.
And I think you heard this, but obviously, I didn't contribute as much as Brad, right? That wasn't in my means. This is not something that should wreck your financial plans. If you're in a place right now where you're trying to get out of debt personally yourself, don't do this right now. This is not the right time or place. But if you're an individual that has significant means, significant net worth, and this idea of effective altruism really appeals to you, and you want to make a dent and make sure your money is going farther and having an impact on the world, I think this is a great way to do it. And if you want to partner with us, if you want to do this anonymously, absolutely. If you want to do this on behalf of someone else and you want us to acknowledge that, let us know. We'd love to partner with you on this and make this a big project that we can get excited about. Someone beat us to it, Brad. Someone already donated $26.
Nice.
So on Friday, when this episode goes live, you're going to see $1,526 at minimum when this goes live. And I would encourage you just to join us. Let's see what sort of impact we can have. ChooseFI.com/RIP. Should I try again, guys? Romeo, Indigo, Papa.
Not Indigo, India.
Oh, India. Oh, I was so close. Okay. Well, unfortunately, that is going to bring this episode to a close. Now, as you know, we like to finish every episode by doing a drawing for a copy of a book that we have found useful. Right now, we're doing our book, ChooseFI, Your Blueprint to Financial Independence. To enter the drawing, all you need to do is just go to ChooseFI.com/iTunes, follow the instructions there, leave us a short written review, send us an email to feedback@ChooseFI.com, letting us know that you left a review and what screen name you left it under. We give away one book for every 5 written reviews that we get, and we announce the winner on the Friday Roundup. So MK, how many winners do we have today?
Today we have one winner, Meg. So Meg writes, Game Changer. I have been binge listening to your show, now up to episode 122. So she might hear this a little late. With the travel hack you guys introduced to us, my wife and our children have been able to visit her parents in Japan every year without affecting our financial future. It is such a game changer for us. Thank you guys and keep up the great work.
You know, and if you can go to Japan, you can go anywhere. Literally anywhere. You're only limited by your creativity and your zone of awareness. If you want to increase your zone of awareness, if you want to get started on your own travel rewards journey of everything we've said here, you know, pick the what works for you. But if you really just want to learn how all this works, go to ChooseFI.com/travel. ChooseFI.com/travel. We have a free course, completely free, and it will take you through the various steps on how to go about earning these points and redeeming these points to travel the world at very, very little cost. Nearly free. A couple fees in there. A couple fees, $5 or $6 here and there. Virtually free. No, almost nothing. It's not even worth considering. It's like a rounding error. It's totally free. All right, my friends, we'll see you next time as we continue to go down the road less traveled.
You've been listening to ChooseFI Radio Podcast, where we help middle-class America build wealth, one life hack at a time.